Just gonna jump into it. Conscious sedation methods are used for, what are they used for? What do you guys think? So sedation would be like a set of something that you take, like something
Like
that makes you,
Valium
yeah, Valium,
or-
exactly. So that's usually for anxiety management or pain management. Yeah. Conscious sedation methods are used for anxiety management and or pain management.
You said anxiety and what?
Uh-huh. Okay. So the efficiency of drugs refers to the maximum intensity of a drug. Correct? That's the true statement. So that would be true. So efficiency is maximum, like efficient max, when it comes to the intensity of a drug. What level of consciousness is the patient during nitrous oxide sedation? I'm asking. Talk. Hmm? Like if you're, so if we're on nitrous would be completely conscious. So there's levels to the sedation, and nitrous oxide is is a fantastic thing to where it only affects you while you have it on, and it doesn't hinder you in any way afterwards. So once you remove it, you're normal. So that will leave you just completely conscious. Doesn't put you to sleep. If you're asleep on nitrous, that's not good. Like you're not supposed to be sleeping. You're supposed to be waking up. So, this is which are the following. I'm gonna read some stuff and you guys just tell me which ones are true. Which of the following statements are true about the use of fluoride in dentistry? A, both system and topical provide benefits. B, can reduce caries up to 70%. C, capable of eliminating caries. Or D, A and B. It's A and B. So eliminating caries, the only way to get rid of a cavity is to remove it with a drill. Like you have to remove the whole physical, like the bacteria, and take it out of the tooth. Fluoride can stop the growth of the decay, like forming more. Like it will just stop it to wherever, like where it's already grown. It can keep it from progressing more. Not decay, well, not even decay. I take that back. Fluoride cannot stop decay. It strengthens, it remineralizes soft portions of the enamel, which is called decalcification. So what that can do, it can re-strengthen those weakened spots, but it can't prevent decay, remove decay. It doesn't do anything with decay. The only thing fluoride can do, because it's a mineral, is remineralize the enamel. like that's it. So, and that's how it reduces the cavities up to 70%. It's because it remineralizes, it's A and B.
So what is A?
Both system and topical provide benefits. So what that means, system is an oral ingestion, right? So kids in pediatrics and stuff like that, you test the water, see how much fluoride's in there, and you give them a pill to count, like to make up for the lack that they have in the water supply. So that's what they ingest. And then topical would be like a fluoride treatment at the dentist's office, or like mouth rinse.
I'm sorry, was B the
Can reduce caries up to 70%. Okay, if you numb an entire quadrant, that's considered a nerve block. So if the mouth is divided into 4 quadrants. If you numb a whole quadrant, you're blocking the nerve. So I would know what a nerve block is. I would know the word caries. That's something to know. During and or after local anesthetic is placed is the most common time for medical emergencies to occur. So during and before and after, like, because that's the most stressful part of the appointment, right? Like that's when people's anxiety and heart rate and all that fun stuff is going up. That's the only thing that you're gonna actually put in to their bloodstream that could cause an adverse reaction. So that's when it's gonna happen. Because everything else is just localized in the tooth. They might ingest something, but if they ingest something else, it's gonna be because someone got stuck. So, yeah. Before and after local anesthetic is when, is the most common time for medical emergencies to occur in the dental office. As a dental assistant, you need to be aware, like, okay, so the following medical conditions require a antibiotic pre-medication. So it would be an artificial heart valve, congenital heart defect, and total joint replacements are 3 things that need a pre-med. Congenital heart defects.
You said need antibiotics?
Mm-hmm. A pre-medication of antibiotics prior to dental treatment, because if bacteria gets into their bloodstream, then they're screwed.
What was the last one?
Joint replacement, total joint replacement. Okay, this is a true statement. A pregnant dental assistant has the right to refuse to work with nitrous oxide if she is worried about its side effects or just doesn't agree with its use. That is true. This is a true statement, an oral, which is a pill, oral sedation does not result in complete loss of consciousness. That is true. That would be considered partial conscious sedation if it's oral.
Can you say that again?
An oral sedation does not result in the complete loss of consciousness. That is true. It does not. Okay, questions? No? Alright, before we jump into doing work on like new stuff, I figured I got this to work. So, that means